Good morning. Thank you for joining us this morning. Teresa's not here today. I'll read the total case counts for our region. We now have a total of 13,891 cases to date, an increase of 54 cases from yesterday. Of these 54 new cases, 20 cases are close contacts of confirmed cases, 7 are community acquired, and 27 cases are still being investigated. As a total, we have 329 cases that are currently active. 13,159 cases have been resolved. So far in our region, we have 70 preliminary confirmed preliminary COVID variants of concerns have been identified in our region. And out of these, 3 are confirmed as UK variant. Unfortunately, we have lost 403 lives as a result of COVID, and this has not changed from yesterday. 14 cases that are currently active are hospitalized, 4 are in ICU. There are currently 8 active outbreaks across Windsor-Essex, 4 community outbreaks, 3 workplaces, and 1 school outbreak. As far as vaccine status is concerned, we now have 78,615 Windsor-Essex residents who have received at least 1 dose of the vaccine. Out of these, 66,336 residents have received only 1 dose of the vaccine, whereas 12,279 Windsor-Essex residents have received both doses of the vaccine. I'll now move on to my daily briefing. Our region has been in the red control level of the COVID-19 response framework for more than a month now. The province sets the levels of the framework as well as determine, based on the most recent data and information, what level each region of the province should be set and what kind of regulations are applicable in that control zone. Red control sets out strict limitations and restriction for most activities, with the focus on limiting interaction between residents and ensuring that the number of close contacts each of us has remains low. In order to support businesses during this unpredictable time, while continue to manage and limit the spread of COVID-19 within Ontario, the provincial government has announced some changes to the regulation for areas in red as recent as this week. Throughout the pandemic, there have been many changes to rules and regulation for businesses, especially for owners and operators of restaurants, bars, and food and drink establishments. Owners and operators of restaurants, bars, and food and drink establishments must continue to ensure that all required COVID-19 public health measures are in place to keep staff and patrons safe, while also ensuring compliance with the requirements of Ontario Regulation 493/17, food premises, and other applicable legislation, including the Occupational Health and Safety Act. As of Monday, March 29, the following capacity limits to restaurants, bars, and food and drink establishments. Restaurants and bars can permit up to 50% of the capacity of their indoor dining areas to a maximum of 50 patrons, including a maximum of 10 patrons previously was a maximum of 10 patrons. All patrons must be seated and able to maintain physical distancing of at least 2 meters from each other. For indoor dining, all persons seated together must be from the same household. For outdoor dining, there is not a specific number of people, but previously 100 people in total was allowed, but they must be limited to allow for a minimum of 2 meters of physical distancing between them. People do not need to be from the same household if seated outdoors. Dancing, singing, and live music is not permitted at any food and drink establishments. As well, the volume of the music played must not exceed the level at which normal conversation is possible. All persons must wear a face covering when leaving their seated position, and workers must wear a face covering at all times and eye protection at minimum when 2 meters of close to each other, to others. These changes allow these businesses increased ability to operate closer to their capacity, but it's also important to ensure that they are adhering to the public health guidelines for the safety and well-being of their patrons, their staff, and also the community at large. Each time the restrictions are lifted to allow for more people to come together, there is an increased risk for the transmission of COVID-19. While we are making great progress with our vaccine rollout, we must continue to be diligent in adhering to the public health measures to keep ourselves and our community healthy. We know that we have community spread of COVID-19 and variants of concern in our community, which are associated with increased transmissibility. It is critical that if we are choosing to get out and engage with community outside of our homes, enjoying the nice weather, we must maintain a 2 meters physical distance from those outside your household, limit the number of close contacts you have to as few as possible, wash your hands with soap and water frequently, wear a face covering when out in public. Most importantly, stay home if you have symptoms of COVID. Don't take chances. The Windsor-Essex County Health Unit updates our website daily and as restrictions and measures changes. To review the current restrictions for our region, go to our website at www.wechu.org and click on the red control button. Thank you.
We'll now take questions from the media. Is there any questions from Blackburn?
Yes, good morning. Dr. Ahmed, you talked a lot today about, maintaining your distance, keeping your close contacts to a minimum. Obviously, we know that Easter is coming up this weekend. I wanted to talk to you about your message about people. I'm sure there are people who, a lot of their family members, whether they're healthcare workers or seniors, have already been vaccinated, at least with one dose, and are thinking that perhaps it's safe for them to get together. What is your message there?
So for Easter-related message, we have some messaging planned for distribution tomorrow. So we'll be working on that, and I'm sure that our team is also working on the social media messaging related to Easter. So you will be getting some of those messages directly through that channel. But for those people who have received their vaccine right now, based on the evidence and based on the data and based on the Canadian guidance, we still don't think that one dose or even 2 doses of getting the vaccine gives you the ability to gather with other people. The current guidelines, the current restrictions continues to be in place, and there is no guidance for people who have received their vaccination. So even if you have received the vaccination, the same level of restrictions and same level of precautions are applicable to you. And we have seen cases are increasing in other parts of the province. We are also seeing, even in Windsor-Essex, we are seeing some fluctuations. A couple of days ago, we reported 59 cases. Today, we are reporting 54 cases. And then there are other days when we are reporting cases in the 20s. So there is this potential, especially when variants of concern is in play, that things can get bad really quickly. So it is important that we continue to follow the guidelines and we continue to recognize the importance of these guidelines. These guidelines are there for all of us to be safe in this pandemic. And the more precautions we take, the less chances anyone will have to contract COVID.
Okay, thank you.
Any questions from Windsor Star?
Yes, good morning, doctor. Speaking of the easing of some restrictions for bars and restaurants, up until this point, has the health unit identified many, if any, cases associated with spread at bars and restaurants?
At this point, no, but that's a great question, because we would like to see some data, on ongoing data, that easing some of these restrictions has it resulted in any difference, or if it didn't result in any difference in the number of cases that we are seeing in the community. So we are paying a close attention to it right as of today, since the restrictions are eased. We don't have any data to suggest that things are getting bad, but we also know it takes some time for any of these measures to show some impact. So we will be looking at it, and we will share the information if and when it becomes available.
Are you concerned, though, that the easing of restrictions for specific businesses might confuse residents in terms of the messaging that they still can't have more than 4 people over at their homes?
Yeah, it does, and I think that's where the challenge of these risk communication when it happens at the different levels and these restrictions. I think the key message continues to be, we have to limit and reduce the number of close contacts that we have, and irrespective of the setting that we are talking about. When you're talking about in home, it's a different environment. It's the people that you live with, it's indoor environment, and those are the people that you're spending quite a long period of time in close proximity, and probably you don't even wear the mask. But when you're out in the businesses, there are some strict requirement and there are some enforcement that's happening in these places and businesses. So there is a slight difference, but I hear you. It can be confusing for people, but all these restrictions are in place based on the potential risk from these type of events and activities. And as more and more evidence comes in, we'll continue to look at what works, what doesn't work, and make appropriate recommendations.
Thank you.
Any questions from AM 800?
Good morning, Dr. Ahmed. Just following up on Taylor's questions. Just in regards to easing of the restrictions, and I know you mentioned right off the bat, it comes down from the province. If they're easing up the restrictions, doesn't it make sense we're going to see more cases go up? That's where I'm just getting confused. So if the province is worried about cases going up, why would they ease the restrictions?
Well, that's a great question, Rob, and you rightly identified some of these decisions are a provincial decision that happens at the provincial level and not at my level. But any opportunity that we are providing people to get together in large numbers, and if they are not taking the precautions, there is this potential for a spread. But I think what is also important to find that right balance, we recognize that there are some mental health challenges, there are some economic challenges that people are experiencing, and how do we find the right balance to ensure that we are not jeopardizing one more than the other. So it's a very, very tough balance, and while there is a potential, so my whole purpose of going through the details of these restrictions is not only for people to understand what they can and what they cannot do, and the importance of adhering to the public health measures. And as I reported, that other regions are already seeing an increase in the number of cases. We had the opportunity in the past too. If we continue to follow these measures very, very carefully, and we can still, maybe had a mild third wave, if you want to call it, and that's the hope. But any restrictions, anytime restrictions are eased, there are opportunities for it to for increased transmission, and we, as I told Taylor, that we'll be looking at these numbers. I've already asked my EPI to make sure that if there are any evidence to suggest that no, the cases are increasing as a result of those specific restrictions or easing of those restrictions, then we'll have to figure it out a way that how we can avoid that and how we can mitigate the risk associated with that. But you're right, every time you lose the restrictions, there's the potential for a spread.
I guess, like you mentioned, these restrictions, they eased a couple days ago, the 29th, I believe you said. For the past couple of days or even over the weekend, has the health unit heard from bars, restaurants about the easing of the restrictions?
I'm not aware of any concerns. I think everyone is busy in making sure that their place is ready and they're complying with the requirements. Our team definitely works very closely to make sure that all the information is available for the businesses on our website, and they are able to address any questions that we receive from the community. So we are focusing on that. We haven't heard a lot. I think it's just making sure that all these businesses are operating in a safe manner. That's the key message at this time.
Thank you.
Any questions from CTV?
Yes, good morning. Ford is warning that there could be another province-wide lockdown as cases surge in other areas. Do you think that it would be unfair for Windsor-Essex, considering that the region isn't as bad as some of the other areas?
Well, I think that's the most difficult question that the province has to deal with, because not all the regions are the same, and there are significant variation in every region of the province. And it's like, even when we were talking about the first wave, we didn't see many cases up north, but when the lockdown came in, it was lockdown everywhere. So it may be a difficult one for the province to make, that how far they want to go ahead with the lockdown, and whether that would be like a provincial lockdown or a regional lockdown. We don't know. And as I said, I haven't been part of any of these conversations at this time, but we'll have to wait and see what the province decide. The cases are increasing in the province. I think there's no doubt about it, and it's not hidden. We are seeing the cases going up consistently between 2,400 cases in the province, which is a lot than what we were seeing a couple of weeks ago. So there is a trend, and there is a risk that it can get worse. December, January, we were seeing cases close to almost 4,000. So we definitely don't want to be there. We are also hearing some other, concerns from the hospitals and from the ICU that this particular wave is hitting the younger people more, and it is coming fast, and it is leading to more ICU admission. So we have to be careful. It's that fine balance of making sure that we are protecting the health and well-being of our community, and also finding that right balance to support everything else.
And now that the AstraZeneca pilot project's almost over, would you say it was success in this region, and did it help out the health unit with the vaccine rollout?
Absolutely. I think we are ahead of many of the other regions of the province because of AstraZeneca vaccine rollout in our community, and the coverage rate for 60 to 64 is pretty high. And thanks to all the pharmacies who rolled out the vaccine for us in that particular age group. So we will continue to see more and more uptake within the other age category, as we continue to bring the age brackets down and offer it to as many residents as possible. We need more vaccine. We've got our clinics, and when there's more vaccine, we should be able to vaccinate more people and get our region as safe as possible.
Now, I know I asked a similar question yesterday, but has any more direction been given to pharmacists of what to do with the leftover vaccines?
I am not aware of that direction yet. Sorry.
No problem. Thank you.
Any questions from CBC?
Yes. Hi. Good morning, doctor. I'm just wondering, with the changed restrictions at restaurants and bars that you were talking about, do you think there's going to be some increased enforcement coming out?
Well, our enforcement have been there already. We work very closely with the business association, and we also want to work with all the businesses, because I think we all have the same shared goal of keeping everyone safe. So we are doing that education enforcement all the time, and that's an ongoing process. I cannot say that there will be like an increased work on that part, but any area of concern that we are identifying, we'll be addressing that, making sure that everyone continues to follow the public health measures.
Okay, and then I know last week my colleague Carrie, she asked about why we have lower variant cases here compared to other health units. And I know that you said that, it was about the measures that were in place here, but could it just be the fact that yet again, we're behind what other areas are seeing, and that we'll eventually see that increase?
Well, I think that's the eventuality, and I think I made that comment in the beginning that when other regions were seeing variants of concerns, and our region didn't see any in the beginning, but it was, I guess, almost inevitable not to see the variant of concern if it's spreading in the province. And we have raised very quickly to 70 cases of variant in our region. So it will increase. It's not I don't want to say that we won't see an increase. I think it will eventually be the most dominant strain that we are seeing circulating in the province and in the country. But the precautions are important. If we are following the precautions, it will protect us. And more importantly, I cannot emphasize much. I think this is the critical time, and then our team is also reporting that people, when they have symptoms, they have to stay, they have to get tested. That's the critical part. And that's where, maybe people are either getting fatigue or getting thinking or ignoring their symptoms. It's not the time. We are still in the pandemic. If you have symptoms, if you have any concerns, go and get tested. And that way we can do an early containment before it spreads. And as long as people are following the precautions, we can be in a better position. And we certainly hope that everyone is listening and following these precautions.
And then I'm also just wondering if you can provide an update on asymptomatic testing, that campaign that's happening in schools. So updates to number of students tested or any that have come out positive, if you have those numbers.
I don't have the numbers in front of me. All I can share that we haven't seen any positive based on that asymptomatic surveillance testing. So I can have, I'll see if we have access to that data, and if we can share that data with the media.
Okay, that's great. Thank you.
Any further questions from Blackbird?
Just to follow up on one of Melanie's questions, do you know if pharmacies have a lot left over, or if there are certain pharmacies that still have vaccines? I've gotten a few emails from people wondering, who still has vaccines, or where to go. Yeah,
I think there are some pharmacies that still have vaccine. It's not a lot, and I'm thinking, and I'm looking at Mike, that maybe if they go to our website, if they are they identifying if they have any vaccines available or no?
No, just a list of.
Just a list of pharmacies. Yeah. So unfortunately, it's not identified which pharmacies have the vaccines and how they can go. But for the larger chains, if you just call them, they will probably let you know, and we'll see internally if there's any way for us to flag that.
Thank you. Any further questions from Windsor Star?
Yes, Doctor. Earlier this week, we saw that London put the emergency brake on, and that at the request of the medical officer of health, they moved from the orange zone to the red zone. So what is your threshold for moving Windsor-Essex to further restriction back to the gray?
Yeah, so great question. There is no provincial indicator to say that what is the threshold for people to go into the gray lockdown category. There are still a lot of restrictions in place under the red zone, and I think historically the province looked at least a case rates of close to 80, and in some cases more than 100 cases per 100,000 population in a week time. That's their threshold that was their threshold, close to that, combined with some of the other indicators to move region into a different place. For London, what they have seen is they saw a concerning trend with their cases doubling very quickly, and then that led them to go into a more restrictive zone. We are monitoring that number locally, and obviously the case rate is the most important indicator of how the community is seeing the spread, and where these cases are happening. If they are happening in a very controlled environment where we have the ability to contain it, I think that's an easy one. But if we are seeing cases increasing in an uncontrolled environment with very difficult population to control, that would be some of those indicators that I would be looking at. But our case rates would be the most important indicator. If we start to see a sudden increase and a very sharp increase with some concerning areas, we'll be having some internal discussion to see whether it makes sense, what's working, what's not working, and if there's any way that we can support it locally. If not, then do we need some kind of provincial approach on that matter?
Okay, thank you.
Any further questions from AM 800?
Doctor, I'm going to ask you this question at the end of the month, every month. Just with March wrapping up, how do you think we did in March? By my numbers, I think we had about, if I'm correct, 905 in cases and 21 people passed away. Just want to get your thoughts on how Windsor-Essex did for the month of March.
Yeah, so great question. I think you're ahead of me in doing that number and checking out how we did in the month of March. It's I think overall the month of March we focused more on the vaccine rollout, and I think that went really well from a case perspective. Seeing 900 cases, and I'll have to rely on your number. So, if that's the accurate number, I think we didn't do too bad. There are regions that are seeing that. It's unfortunate to lose any life in the region. I think that's the most difficult part for me and for my team and for everyone else in the community. When people die, I think that's really bad news. When people are in the ICU and really suffering, that's also not something that we like to see. So overall, I think we did a decent job in terms of containing the spread, and we hope that it continues to stay that well. I stay that way. I really hope and pray that we don't have to deal with a third wave. I think our community has suffered enough, and our healthcare workers have suffered enough. Like it's been exhaustive. Like everyone is burnt out at this time. And we really hope that we don't have to deal with the third wave. And if we follow all of these measures, if we can survive this, and with the vaccine rollout, I think we'll be in a much better position. And I really hope that everyone just follow, and we can avoid this third wave at all in our community.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yes, I'm just wondering if there's any update on the funeral cluster cases that were discussed yesterday.
No, I don't have any additional updates other than what was shared yesterday.
Okay, and then I know yesterday there was that new funding announced for the IRC in Windsor, and there was some talk that was brought up as part of that announcement of vaccinating migrant workers. I just wanted to see on your end if there was any updates on the conversations being had around vaccinating them or plans around that.
So we are working internally on the plans for vaccinating migrant farm workers in our region. We don't have a specific date that we can share at this time, but we have started doing some of that work, recognizing that that's the phase 2 priority population that needs to be vaccinated. We have seen a large number of cases in that population, and when we are looking at the overall region and the distribution of cases, that constituted a significant portion. So as soon as we are in a position to start vaccinating them, I would like them to get vaccinated. And so stay tuned, and we'll share more details. That we have been working on a plan right now, and we should be able to share some additional details in the coming week.
Okay, thank you.
Great, thank you, everyone.
Okay, thank you.
Thank you.
Thank you.